Hello, I'm Morie Gertz, Chair of the Department of Medicine at Mayo Clinic. I've been attending the American Society of Hematology meetings, and I'm genuinely impressed with the advances that have been made in only 12 months period of time. There are a number of specific presentations that I consider breakthroughs in the field that are worth commenting on. The Italian Multiple Myeloma Study Group did a study in patients who were not transplant eligible, comparing 4 medications, bortezomib, thalidomide, melphalan, prednisone, with 3 medications, and found an improved overall survival in the 4 medication-treated group. This is an important new finding that we previously were not aware of. We're seeing new uses of the newly introduced and newly approved drug carfilzomib. In trials, carfilzomib has now been combined with cyclophosphamide and dexamethasone for newly diagnosed patients who are transplant eligible. Carfilzomib has also been combined with thalidomide and dexamethasone in a very large trial done by the Netherlands group that demonstrates very deep response rates without excessive toxicity. Carfilzomib has been also combined with the new medication pomalidomide and dexamethasone for patients who've had heavily pretreated multiple myeloma and show the ability to produce clinically meaningful responses. The monoclonal antibody elotuzumab, an antibody against the anti-CS1 membrane protein found on all myeloma cells, is being combined with chemotherapeutic agents, both bortezomib and lenalidomide, and shown to have very high activity. Another vista in the treatment of multiple myeloma is the introduction of a brand new monoclonal antibody that attacks the CD38 protein found on the surface of multiple myeloma cells. This is a very preliminary study that's predominantly involved in determining the safe and effective dose, but this agent does appear to have significant activity, and being a non-chemotherapy agent has the potential to be safely combined with the newly effective agents that we've learned so much about in the past 12 months. Antibody therapy is increasingly being explored in the treatment of multiple myeloma. Daratumumab, a monoclonal antibody that attacks the CD38 protein found on the surface of all myeloma cells, has been found to be safe in a dose escalation study and appears to have activity in multiple myeloma. This suggests that it will be effectively combined with the already active chemotherapy combinations to improve the depth of response, the duration of response, and ultimately survival for patients with multiple myeloma. A paper that involved participation from multiple centers across the United States looked at the impact of induction treatment before stem cell transplant. This important article indicated that even if there's a suboptimal response to induction therapy before transplant, that stem cell transplant provides significant benefit to these patients, and that transplant need not be delayed to try a second induction regimen. It's quite inspiring when we realize that agents that have just been approved for 3 or 4 months are already undergoing testing with multiple combinations that further improve its efficacy. It's very reassuring to realize that stem cell transplant has a potential role for selected patients with multiple myeloma. And it's very exciting to learn about 2 new monoclonal antibodies, essentially non-chemotherapy treatments for multiple myeloma, that when combined with known effective chemotherapy regimens further improve the outlook. The response duration and the survival for patients with multiple myeloma, which has quadrupled since I began practicing, will continue to improve over time, turning multiple myeloma into a chronic disease.